In part one of her series, CBS 21's Eva Roman showed us the shocking reality that anyone can become a drug addict, even doctors. And we met Chris Davis. He's a former family physician who was able to get better after rehab.
He enrolled in a program which many people don't even know exists. It's specifically designed to help doctors who are addicted to drugs or alcohol here in Pennsylvania.
And as Eva shows us tonight in part two of her series, that program also introduced him to many others just like him.
Thank you.
We first introduced you to Dr. Rodney Hough in 2006. After almost 30 years in practice, he had to close his doors. Hough still has a medical license, but can't get paid from Medicare or Medicaid because in 2003, he was convicted of misusing and abusing prescription drugs.
It's what you think about 24 hours a day.
Dr. Hough's problem started in the 90s. He had chronic knee pain. That's when Hough says he began taking pain meds.
It took more and more to relieve the pain, and I got to the point where I just couldn't stop. I tried.
And getting a refill was as easy as looking through his own supply closet, writing his own prescription, or asking a doctor friend for help.
I would utilize samples. Some of my orthopedic friends would give me prescriptions.
Sober now for more than 6 years, Hough no longer treats patients. Instead, he treats former addicts like him. And he owes it all to the Physicians' Health Programs, created locally to help doctors addicted to drugs or alcohol.
Most physicians and most professionals don't know that the program is there until they need it.
J. Michael Moses is the chairman for the Physicians' Health Programs in Pennsylvania. He says the number of cases of doctors becoming addicted to drugs or alcohol varies year to year. He says in 2007, the numbers were slightly up from 2006. Even so, Moses says the Physicians' Health Programs make it possible for addicted doctors to kick the habit and get back to work. In fact, he says 92% of doctors who complete rehab through the program stay sober, maintaining their licenses and positions.
What I realized is that recovery has to be number one in my life. Because if I don't have recovery, I'm not going to have family, I'm not going to have a job, and I'm not going to be happy.
Dr. Hough says the Physicians' Health Programs gave him back something he'd lost years ago.
Drugs and alcohol are not an option ever. I really don't even think about it now. And that's astounding to me. Before I went into recovery, that's all I could think about. And now it's not even part of my life.
Asking for help, he says, is the toughest and scariest part of all. Eva Roman, CBS 21 News.
Well, there is no one source you can go to find out if your doctor has gone through or is going through substance abuse treatment. But depending on the situation, the Physicians' Health Programs is responsible of notifying certain patients of substance abuse. To contact the Physicians' Health Programs, just call the number here on your screen, 1-866-747-2255.
Got to admire these guys for coming forward with their stories. Sharing this takes a lot of courage. And certainly, hopefully, by telling us what they've gone through, and somebody else could be inspired to come forward and do the same thing.
Get some help. It's something you really never hear much about. So. Right.